My name's Martin Troedel. I'm an advanced physiotherapist practitioner, and my role at Salford is working in the emergency department. So I see patients as soon as they attend. They've come through triage. I'll take a history, do an examination, request any investigations for them, and really see them from the front door right through to discharge and coordinate any ongoing care that they might need. My core skills as a physiotherapist are musculoskeletal, and they're the types of patients that I tend to see because we've developed expertise in that area. So my typical day in A&E is firstly not typical, which is one of the reasons I love working in A&E. I love the problem solving. Every case is a little bit different. I've just seen a lady who was driving to work this morning. She was in what we call a low energy motor vehicle accident. She was anxious because she had a previous fracture to her neck and she had some tenderness in that same area. So what I could do as an advanced practitioner is request and justify an x-ray of her neck. Previously, as a physiotherapist and not as an advanced practitioner, I would have to ask a colleague if they could request the x-ray. I'd have to ask them to look at the x-ray, and I'd have to ask them for their advice. I'm now able to do that completely independently and autonomously. I'm also able to prescribe the medicine that the lady needs, and also I bring my physiotherapy skills and give her the expertise in looking after her neck injury and what to expect in terms of a recovery.
Previously, what used to happen is that the medical staff within the emergency department used to see those patients and they used to say, nothing's broken, you might have a neck strain or a whiplash type injury, go away, take some pain relief, rest. If it doesn't get better, go and see your GP. Patients can't and shouldn't wait 2-3 weeks to get an outpatient physio appointment, because by that time their initial rehab, where they could have made themselves better quickly, has gone.
I find that our A&E consultants will ask our opinion on certain conditions, whether we think this is a fracture, whether we think a spinal patient needs an MRI scan or further investigations. So we can see a lot more conditions, and that's great for the consultants because they can concentrate on the really sick patients in resus and the major areas of the department. The majority of advanced physio practitioners that work in A&E also spend some time during the week doing the virtual fracture clinic, and that's really helpful because I'm seeing the same patients that I saw in A&E the day before, and I'm referring them onto the virtual fracture clinic, and then I'm seeing them with an orthopedic consultant and we're making a decision on treatment and management. And that's really good because I've got that insight from both orthopedics and A&E, and I can give the patient the right advice, let them know what to expect and what to do in the meantime while they're waiting for their virtual fracture clinic appointment. We've asked patients what they think of the service and have all been really positive and really happy. So the feedback has been excellent. And so that can help develop the service, not just for us and for our team, but for patients and for the wider NHS. One of the 4 pillars of advanced practice is education and teaching, and I've been seconded to the university 2 days a week, so that gives me the opportunity to formally lecture. I teach on the advanced practice course and on the Masters in Physiotherapy course. I love that opportunity. I've always enjoyed teaching, so I teach in a formal, professional manner. But my day-to-day job here in A&E and in the virtual fracture clinic is also about education and teaching. For me, it's a natural progression of my career. It sort of develops all the core skills I've always been interested in. And for me, it's the most important decision I ever made in terms of my career development.